We now come to our first presentation, where at the end of the presentation you will have an opportunity to ask some questions. One of the things that Minister Skinner was talking about there was a huge investment that is going into the emergency department at St George Hospital. So I'd now like to invite Miss Cath Whitehurst, Director of Operations, St George and Sutherland Hospitals, who will lead a presentation on those capital works that are currently underway at St George Hospital. She'll be joined by Dr Trevor Chan, Emergency Director of St George Hospital, and Mr David Pearce, Director of Operations Mental Health Service in the local health district, who will give an overview of the two major capital works projects, including the St George Emergency Department, as was mentioned, the redevelopment there, $39 million, and the subacute mental health older persons unit, $8 million. Dr Trevor Chan is the St George Hospital Emergency Department Director and has worked as emergency physician at St George Hospital for the past 10 years. He's been working closely with the emergency team, executive, architects and project managers on the emergency department redevelopment project. Dr Chan is an advocate for patient safety and quality care and participates in quality systems assessments with the Clinical Excellence Commission. He is a member of the Incident Advisory Committee and the Emergency Care Institute. Mr David Pearce was appointed to the position of Director of Operations Mental Health Service, Sydney Eastern Sydney Local Health District in 2011. He had previously held positions of Director of Mental Health, St George Sutherland Hospital since 2004, and prior to these appointments, Mr Pearce held the position of General Manager of St George Hospital. So we now welcome up Ms Cath Whitehurst, Dr Trevor Chan and Mr David Pearce.
Thank you very much. I am Cath Whitehurst, that's true, the Director of Operations for St George and Sutherland Hospitals and Health Services, which includes the Garrawarra Centre. My job was to introduce the speakers, so I think that's been done. So without further ado, I'll introduce Trevor Chan to come up and talk to us about the St George Hospital Capital Works Program, which is a $39 million development for the ED, and he will be followed by Mr David Pearce, who will talk about the subacute mental health service. Thank you.
Thanks, Cath, and welcome everyone, and welcome to the ministers. I'm going to run through a flyover animation that we've developed as part of the emergency department, and I'll just make a couple of stops along the way to give everyone an overview of where we're at. So if I could get the presentation started, thanks. So St George, as we've all heard, is undergoing a redevelopment phase. To give you some orientation, our existing emergency department is located on Kensington Street. Our new department will be located on Grey Street. This is if we could just stop there for a moment, this is an overview of the St George campus, showing the main areas, the existing ED, the new ED coming up on Grey Street, as well as the other integrated areas that make up the rest of St George. So for those of you who use the hydrotherapy pool, you'll see it over up on the Belgrade Street side. And the tower block and the ward block are the other sort of clinical areas that are really important. Thank you. A lot of the redevelopment with St George Emergency was done in conjunction with a master plan to make sure that where the department was going to be in the appropriate spot. As you can see, the site of the department on Grey Street, but also the other areas that we've mentioned here. If you just stop there for a moment, what this really shows is that within the discussion with the master plan, moving the emergency department to Grey Street really opens up St George's campus. It'll enable further redevelopment for departments on top of the new emergency, but also frees up the whole space where the current emergency department is for redevelopment, as well as further development where the current administration is. As the Minister mentioned, we are a very busy department. We've seen 67,000 for the last financial year, and that's heading increasingly upwards. We're the tertiary referral centre as well as the teaching centre. So this is the fly-through coming through from Grey Street, heading towards the new entrance adjacent to the main hospital entrance. We'll go through here into the main waiting room, and I'll just stop it there for a moment. You can see from here, patients will be able to identify whether they need medical attention or clerical or other support services. From here, the other departments will link. So on the right-hand side will be our paediatrics. On our left-hand side will be our adult fast-track area. Thank you. And very close by will be our resuscitation bays, which you'll just get a glimpse of. We're going into the first of our 2 halls. This is called Hall 1, and it's designed in that sort of traditional racetrack design with the beds around to allow great visibility. It's really been designed in conjunction with the architects and looking at all the sort of services and features that we would need in the new department. And we're looking at all sorts of areas in terms of flow, thanks in regards to making sure that all the models of care we want work. The Hall 2 is of a similar design, but that'll have a specific area for seeing patients with mental health needs, as well as leading on to our emergency medicine unit and the psychiatric emergency care centre. And we also have an area adjacent to our resuscitation bays and areas for our imaging. So it's a very exciting prospect. We joined the Minister on the car park looking over the site, and we're really pleased that it's finally underway.
Good evening, ladies and gentlemen. My name is David Pearce and I'm presenting on the Older Persons Subacute Mental Health Unit. It's a 16-bed unit currently being constructed at St George Hospital, and it's going to care for older people that have mental illness. I'll be speaking to a brief video presentation without the wonderful bells and whistles that Trevor's had. I'm quite jealous. So thank you. We'll have a look at the first overhead. And similar to Trevor's presentation, we'll have an aerial view of St George Hospital, and you'll notice there on campus that it orients us to the location of the existing mental health unit. We can see it there in South Street, and the new older person subacute unit will be built right alongside the existing acute mental health unit. It's also important to note that we have an older person's community mental health team based at Cogra as well. So it's going to be in close proximity to the new unit that's being built, the inpatient unit, and that'll really promote an integrated model of care between inpatient care and community care for our older adult population. So that's really important. And the new unit is also in very close proximity to the multi-storey car park at Cogra, so that'll provide visitors and carers with ready access to our new unit. So this is a master planning process has been undertaken in 2011, and this presents a graphic of our current site showing the location of our 28-bed mental health unit and the proposed location of our new subacute mental health unit. This, similar to Trevor's slide, this is a very important point that when the subacute unit was designed and is now under construction, with the vision of Terry Cloud, we insisted that it be future-proofed so that we could add additional stories to the existing subacute unit to provide for expansion. So you can see in blue the subacute mental health unit provides for 3 additional levels which can be added in the future. This is a different perspective on our existing mental health unit and the footprint for the new unit, taken from the perspective just over South Street at the multi-storey car park. Okay, so the new subacute unit, you can see the footprint for it there. It's very close, as we said, to the car park on the left and is integrated with the existing mental health unit. We'll now take you for a walk through of the various sections of the unit, and I'll briefly explain each of these to you. They're colour-coded. So this area in red is new offices and support functions. This includes shared reception with the acute mental health unit, staff offices, a quiet room for patients to spend time with their family members, or if they require a low stimulus environment, that is provided for in this room. This section of the building also has several consultation and interview rooms and meeting rooms for patient assessment and discussions in private with family members as required. It certainly promotes integration, as I mentioned earlier, with our community mental health older persons team. They'll be invited into the unit to join in various meetings and joint education with our inpatient staff. This section also includes a fully equipped kitchen to assist with activities of daily living. That's particularly important when we're planning discharge and promoting independence of the patients that we have in the unit. There's also a section here that's only accessible to staff, and that includes office areas and administration. This yellow section is the lounge and activities area. It'll also be used for activities including gentle exercise, cognitive therapy and other formal and informal groups. The lounge and dining areas are in full view of the nurses' station, which is also incorporated in this area. The area in dark blue is an 8-bed wing, the north wing. Each of the bedrooms are single bedrooms. And of course the north wing has to have a south wing. Right, so in the light blue we have the south wing, so another 8 beds. So 2 8-bedded wings, both in full view of the staff station, have been configured to maximise space and light. Identifying colours or photos will be on each of the bedroom doors to distinguish the rooms and provide visual cues for our patients and their carers. To assist staff in caring for older persons who may be obese, that is bariatric patients, 1 bedroom of the 16 has been specially designed and fitted out with appropriate furniture and fittings, including piped oxygen and air. This bedroom is in very close proximity to the staff station. The unit will be furnished in colours and fabrics that have been carefully selected to ensure the environment is calm and relaxing for our older patients, and that is really promoting person-centred care. We have 2 courtyards in the building. This is the first one, the western courtyard. It faces west and will be shaded and will be used mainly as a quiet courtyard. So that's for our older patients that might maybe want to read or have some quiet time out or relax, maybe talk with family and friends that have come in to visit them. Okay, that's another courtyard, the southern courtyard. It's a larger one and it will be promoted as an activities courtyard. It will have a figure-8 directional walking track to promote purposeful movement and reduce agitation of some of our patients. It will be covered with a shade sail and have murals on the walls to soften the effect of the walls. Both courtyards will have soft fall material and artificial grass, planter boxes, decking and seating for patients and their families. The outdoor areas are all visible to staff at the staff station via CCTV. And our final slide. This is an artist's impression of the completed new older person subacute mental health unit. The commissioning of the unit is planned for September 2013 and we look forward to admitting our first patients. I can say on behalf of all the mental health staff in the district, we're really excited about this unit. We will have a state-of-the-art building to really do justice to care of our older patients that have mental health issues. Thank you.